Hello, I am Alondra, one of the TAs for this course, and today we'll be talking about the six-step process of ethical decision making. In Module 2, you may recall there is a presentation that talks about what these steps are, but we're just going to go through them really quick. The first is to get the story straight and gather all of the facts of the situation. Number 2, identify the ethical problem. Number 3, use ethics and principles to analyze the situation. 4, explore the alternatives to solve the situation. 5, choose one of the alternatives and take an action. And lastly, the sixth step is to evaluate the outcome that comes from the situation and learn from it. Here we will be seeing how this six-step process applies to real-life situations by analyzing a video from the Royal Australasian College of Physicians and break it down into these 6 steps. So let's take a look. Since we're analyzing this through the American healthcare system, we have to make a couple of assumptions. We have to assume that the patient has signed off on the right to know and power of attorney if the children are already in the room listening to the diagnosis, discussing it with the doctor, and will be making medical decisions for the parent. So here's step 1. We're first given some facts to get the story straight. The patient, Lee, is 86 years old, has anemia, and rectal blood loss.
Well, it's important for us to look in the bowel to see where the blood is coming from. The only way we can diagnose the cause will be a procedure called a colonoscopy. Are you familiar with that term?
Right, Papa?
Yes, I remember what it is. That will be fine.
Good. Look, we won't know until after the procedure, but most causes of bleeding from the bowel are easily treatable. And the most common cause is hemorrhoids. The other possibility, and it's only a very minor possibility, is that the bleeding could be caused by bowel cancer. But as I said, that's a very minor possibility, so I wouldn't be worrying about it at this stage. I'll see you in a week's time.
Thank you, doctor. Thank you.
Can I speak to you privately for a minute, doctor?
Yes, no problem.
My father is very traditional.
These are more facts that we can add to our list. Here, the son lets us know that his father is very close to Chinese tradition and beliefs, which is a big point to address because it could impact the preferences of the patient.
Many Chinese people believe that thinking and talking about death can speed up one's death. My sister and I just want our father to live comfortably in his old age. If the result of the colonoscopy is cancer, I don't want him to know the diagnosis.
All the best.
This leads us into step 2, because as you can tell by the doctor's face, this is ethical conflict. According to the son, Lee and Chinese tradition both believe that talking about things like cancer will make the individual more susceptible to it, which will worry Lee even more. The son and daughter are trying to keep this information away from their dad, which would result in Lee not knowing anything about his diagnosis. He wouldn't know what's wrong with him, how severe his case is, or even how much time he may have left. But is this really what the patient would want? Should the doctor address it to Lee, or should he just follow the son's request? In this next section, we're going to pay attention to steps 3, which is addressing the ethical principles, and step 4, exploring alternatives.
I mean, what would you do?
Look, from my perspective, this is not even an issue. I would tell the patient. He's the one being treated here, not his son.
But the basic principle that guides us as physicians is do no harm, right? If revealing the diagnosis would cause the patient serious psychological harm, owing to his cultural beliefs and his old age, then wouldn't I be guilty of harming him?
But this is an autonomous person we're talking about here. People have the right to make decisions about their own health care, and keeping them in the dark would be old-fashioned paternalism. We've moved beyond that.
But these patients are traditional, that's the point. And we Westerners have our own view of progress, but it might be wrong.
So as you can see, the ethical principles that are at stake are autonomy, which is allowing the patient to make their own decisions, do no harm, paternalism or respecting one's freedom, and respecting the patient's preferences.
Do you actually know anything about Chinese tradition, though?
No. Admittedly, I don't. I was just going off what the son told me.
See, that's the issue. You're taking the son at his word, but you don't actually know what the patient wants. He might want to know his diagnosis.
You didn't see his face when I mentioned cancer. He looked pretty distressed.
It's a difficult situation, I'll give you that.
It is. Thank you.
That's all right.
Through analyzing these principles, the men throw out a couple of solutions. First, to tell the patient and respect their autonomy, or to withhold the information and prevent harm. Now, this video does not show what happens next, unfortunately, I know. But from our 6-step process, we know that the doctor will choose one of the alternatives to act on and apply. He then will observe what happens in the situation and learn from it so he can apply it in the future in case a future ethical issue like this arises again. The cool thing about this process is that we can apply it to any ethical situation where we're struggling to find what the right thing to do is. All right, hopefully that gave you a little rundown of how to apply the 6-step process of ethical decision making in real life situations. And again, if you have any questions, feel free to let us know. Thank you.